So to Tairawhiti mental health, in the Prime Minister's budget speech to Parliament, I don't think it was lost on this district, she mentioned a visit to Gisborne to meet a group of frontline workers and volunteers, including a mum of a young man who had experienced methamphetamine addiction. What stood out for the Prime Minister is how Tairawhiti does not have one single residential drug treatment facility and not one single bed. And that will now change as a result of the Wellbeing Budget. A total of 200 million is being invested into new and existing mental health and addiction facilities across New Zealand. So we've put a record 1.7 billion into capital investment over the next couple of years. That is really substantial. 200 million of that is specifically ring-fenced for mental health and addiction facilities, because we know that health infrastructure plays a really key role in ensuring New Zealanders have access to high quality services and can get the care that they need. So this funding will support Hauora Tairawhiti to pioneer a new innovative model of care, combining both mental health and addiction services on the same site. Your proposed residential flexible step-up, step-down facility will be used by both mental health and addiction patients and will deliver a much-needed increase in capacity. Staff will be supported to gain the skills they need to provide this new model of care and to ensure there's flexibility to meet the particular needs of the particular people who will use the service, people under 18, young females, those over 65, whoever the group is. And the Ministry has committed to working with Hauora Tairawhiti to accelerate this project in the planning and development stages, and it will include the redevelopment of your mental health inpatient unit, Te Whare Awhiora. So the seclusion rooms, the outdoor areas there will be upgraded as a part of that. It does need updating. And the investment, I'm pleased to officially announce, although good news spreads fast on the kumara vine, I think most people will have heard word of this already, will be up to $20 million for this refit and for this, this new and exciting facility. So I want to offer my congratulations to the community in coming forward with this innovative approach, in wanting to meet the needs in a tailored way. I want to thank those who serve on the board and provide leadership in this area. And Dave, I've already mentioned you, but I'll mention you again for your leadership across the community. The usual caveats, of course, apply. The funding is subject to the confirmation of the final business case and all of that. So you've got your work cut out, and then gets signed off by joint ministers as the part of the ratifying process. So I think that's the key announcement. I will mention the good work that's been done supporting pregnant women and mothers. Te Herenga Mātua, something that I've had the privilege of visiting, and you'll know that this service aims to break the intergenerational cycle of harm from drugs and alcohol, with outcomes focused on babies and children under 3. So I do want to acknowledge all of you here today who've come. Thank you for coming to hear the good news. Thank you for the contributions you're making. Thank you for the contributions you're going to make in designing these services and making sure that we have kaupapa Māori services that are appropriate, and making sure we have services that are appropriate for young people, for old people, for those living rurally, and keep up the good mahi. Nō reira, tēnā koutou, tēnā rā tatu.